Caribbean Surgery Inc. welcome you to Health for Life, the first ever medical show on television that deals with prevalent health problems and concerns in an easy-to-listen to question and answer format. To find out what we are discussing today and to introduce us to the visiting specialist, here is the producer and host of Health for Life, Dr. Surendra Prasad.
Good afternoon. My name is Dr. Surendra Prasad, and welcome to another episode of Health for Life. Health for Life is a program designed to inform the public about common medical conditions. Today, we will be discussing asthma in children. My guest physician is Dr. Rohan Jabour. Dr. Jabour is the most experienced pediatrician in Guyana. Dr. Jabour, thanks for joining us on today's program. Good afternoon, sir.
You're welcome, Dr. Prasad.
As we mentioned a few moments ago, today we will be discussing asthma, and more specifically, asthma in children. This condition appears to be more common today, and Dr. Jabour is here to answer some pertinent questions that we all have on this topic and to shed some light on how we as parents may better cope with this disease. So, Dr. Jabour, what is asthma?
Asthma is actually an allergic reaction of the lung. It's part of the overall reaction that people with allergies can have, and it's the most severe form that the lung is involved in. There are a lot of definitions for it. You might talk about it being reversible airway disease or hyperactive airway disease. But the bottom line is that's an allergic reaction of the lung.
Okay. Now, when we think of diseases, one of the first questions person are going to ask, is it something like the flu? Can I catch it?
No. Asthma you're born with, okay? Some of it, it's either hereditary, in which there's a strong family history, but there can be spontaneous cases that just arises that we don't know the reason why, and that the lung just overreacts.
Okay. The next question when we think of diseases, is this something that I have inherited? Is asthma a condition that I've inherited from my parents?
The likelihood is yes. And it'll run in families and may not be directly related to your parents, but certainly close relatives will show signs of asthma. Okay, and I usually will ask a history for that. But there are cases where it's just spontaneous. We don't know why.
Now, as you and I have discussed before, when I was younger and you were younger, asthma was not a condition that we seem to have talked about or remember as in our childhood. But today it certainly seems to be more common. How common is asthma in children?
I think the problem is that in the past it hasn't been recognized as being present. And it's been, when you ask people about what their childhood was like and whether they had asthma, they'll say, no, but I used to get a lot of colds, I used to get a lot of coughs, I'm always at the doctor every so often, and nobody has told me that I ever had asthma. Nobody recognizes it as asthma. And today, I think that it's not that there's more asthma as such overall, but the fact that we're now recognizing it more acutely, that is accounting for that. There is overall worldwide an increase in asthma, and we don't know why.
Okay. As a parent, and I'm sure you hear this every day, the parents come in, they bring their child, there's a condition. And the first question, or one of the early questions they're going to ask, is asthma curable?
Asthma is not curable per se. Asthma is controllable.
Okay.
We can use medication today that will control the attacks and make the human being survive. In terms of me being able to cure it and say that you'll never have another attack of asthma, no. In fact, one of the things that people will say, you've heard it being said, oh, he's outgrown his asthma. We've learned that that is not necessarily so. Given the right circumstances, you always have asthma because you're born with this hyperactive airway that reacts too suddenly. As you get older, the airways get larger, the stimulus that's needed gets more severe before you get a reaction, and so a lot of times you don't have a problem, especially as you go past puberty. But given the right circumstances, given the right conditions, you can, a person in their 20s, 30s, afterwards who've never had an attack for years can develop an asthmatic attack. And that is not a rare thing.
Now, can children die from an asthma?
Definitely. There's no question. Asthma is not to be underestimated. People die from asthma.
Okay. Now, if we're dealing with a condition that is so severe that you can lose your life to it, one of the things our parents and our viewers are going to want to know, what are some of the signs and symptoms they should be looking for asthma?
If you're looking for signs and symptoms, the most important thing about asthma is that you cough. Okay? You develop a cough usually first. And to understand that, you've got to understand what causes asthma. Okay? What asthma really is. And what goes on is that in asthma, the airways are tightened. If you imagine an airway like a tree trunk, a tree with branches, okay, where the main trunk, if you turn the tree upside down, the main trunk is your main airway that goes down. It then goes into the branches. All of these are hollow. It then goes into tinier and tinier branches. And then it goes on to the leaves. And the leaves are where the oxygen exchange takes place, just like in a plant. And that's what supplies the oxygen to our blood. Now, what goes on in asthma is that these airways, these tubes, then whatever is the stimulus, and there are numerous causes, whatever is the stimulus will cause the airway to react. And it reacts in a very rapid way first, and then in a slower reaction within the lung, within the tubes. I'm now talking microscopically, within each individual tiny little branch of that tree that's going to the leaf. And so what happens with asthma is that the tubes, first of all, is made up, and I've drawn some diagrams, okay, that I'd like to show you at this point, okay? Where now, if you look at it, you will now see that this muscle area, the outside coating of the tube, has a muscle area, okay, and that's in the normal tube, which is what the picture is showing. This is the normal muscle area. Then inside of the tube is a lining of what we call the mucosa. Mucosa is something similar to the inside of your mouth and your eyes, and the whole airway, all your airway, your nose, everything is made up of this type of tissue. And this tissue is a secretory type of tissue, which means it produces mucus. It has the ability to produce mucus. And so what happens in asthma is that the very first reaction of the stimulus, whatever is the stimulus, and we'll go into that later, is that the muscle coating, that outer muscle coating, contracts.
Okay.
And that now makes the airway, the diameter of the airway inside, narrower. At the same time, as time goes by, and this can be minutes or it's usually days, is that the lining of the tube now, that mucosa, starts to swell. And as it starts to swell, it gets thicker, and not only that, it starts to produce mucus inside of the tube, okay? And so that combination of both the muscle thickening and contracting, and then the mucosa getting swollen and producing mucus, is what then clogs up the area. That mucus now clogs up that tube, just like a pipe, where something is flowing through it. You've got stuff now that's built up inside of it. And so if it was a pipe flowing water, the water can't go. In this case, in humans, it's oxygen, air. The air can't get down to where it's needed. And that is what happens in the pathology of asthma.
Okay. Now, we've lumped this together as asthma in children. And as you've always said to us, pediatrics, it's from birth to the early teens. What age can a child develop asthma from?
Oh, that was so controversial earlier on. They said, oh, you can't have asthma before a year or 2 years. No, I've had asthma in babies. And in fact, I've seen asthmatic type reactions in even premature babies that will have reactions of this type, which are similar to asthma. Okay? So it can occur in the very, very young.
Now let's get into what are some of the things that can cause an asthma attack, or a flare-up as we commonly call it.
All right, first of all, you've got to realize that you've got the underlying ability to react. Okay. And the stimulus, or the allergen as we call it, the allergens are the things that will stimulate the allergic reaction. Allergy generates allergen, generates reaction. And it's quite numerous that will do that. First of all, usually it's things that are inhaled most often. And the commonest things are things like animals, pets, dust, smoke, particularly. Any dust, vapors, any of those things can cause it. In terms of things that can also cause it, are things that can set up the lung to react to the allergen and to make it even worse. And these are things like viruses. And so you usually will find a history whereby a person will get a cold, and that sets up the airway to react violently, and then it proceeds as time goes by to become more and more aggressive, and the tubes start to tighten and you get an asthmatic attack.
Okay. So we have talked about the definition of asthma as an allergic reaction. We have talked about what is actually happening in the tubes as you've described it as a tree, and the tubes getting smaller and smaller. And we've talked about what are some of the causes. Next we will be talking about how do we proceed into treatment.